this was the worst public health disaster known to mankind, was I call the attachment disorder that many men walk into. So the suicide or the issues that you see are real. I worked with cops and firemen and emergency medical technicians for 30 years as a trauma therapist. And I realized that we had to create a foundation. And we started at Partners in Men's Health. Many of you know Mila, who I met Partners in Men's Health years and years ago. And I realized we needed to create an international charity that my ex, God love her, had weaponized every skill I had, which was to create a charity to clinically serve and others. And I realized the healing power of the fellowships of AA and NA, but all of them were, my life was unmanageable. I have to turn it over to a power greater than myself. And that's all good and fine. And I'm a religious guy too. And Jesus, Moses, Buddha are fabulous transformation practices. But I also saw that nobody was recovering from complex trauma. So we created the STAR Network to deal with the suicide, the depression, which you just saw, the feelings of the men, what Father X said, hopefully a fellowship, because I think anybody heals a man better than another man who's healing. Currently, we're working with PTSD, and we were asked to come into Israel to deal with the IDF, and they said none of the soldiers are coming out of their houses to get clinical help. And I said, of course not. They don't have another man knocking on the door saying, who has one leg and lost it in IED, saying, it's okay. Trust me. Let's go have a cup of coffee. So we created Taranon, which is a fellowship that has a 12-step program. And it was for suicide and it was for depression. It was obviously for men. Now it's for men and women. And today we're seeing between 700 and 800 people a week. But when I started Partners in Men's Health, I was so sick and I saw nothing for men. There wasn't groups for men. There wasn't a shelter for men. There wasn't a diversion program I could go to. I had been speaking in courts. Those were loaded. So I had to deal with my own, I called Tar Dojo. So 70% of men are struggling with mental health issues. What we have to do daily is to be that strong person. I saw somebody's handle up here was about men cry. And every week when I go to my therapist and be a patient, I just love crying because it allows me to heal. But healthy men need to be with healthy men. When I ran treatment centers, I could get a kid sober in 30 days and they would be great and not take a drug or alcohol. But when I sent them back to their family, they would relapse if they weren't treated 2 weeks later. So we dedicated our mission to three things: treatment of complex trauma, the support of people going through this hell, and that's what Taranon is, Toxic Abusive Relationships Anonymous. Soon to be, like Father X says, dealing with adult children who have been alienated as well. And the third was I saw before about creating a monster. Good doctor from England showed that we're going to have prevention programs on obstetric units, how to teach people not to raise Frankenstein, which is the attachment disorder, because they teach people how to breathe in yoga, but they don't do that. So today, men are suffering deeply in silence. All of us are here for a reason. All of us have gone through that psychological war, I think. Otherwise, we wouldn't be spending our time, unrequited, unpaid for, if we weren't trying to help change the world or help another man for not to go through this. The concept of narcissism and intergenerational trauma is so strong. 1 out of 8 people, according to the American Psychological Association, says has a personality disorder, which means they have 5 indicators or greater: borderline, narcissistic, histrionic, or antisocial. And they affect over 280 million people in the United States alone, whether it's intimate partners, work sites, teens and tweens, conflict caregiving. Narcissistic abuse is literally what all of us have probably had to go through. The rage of an attachment disordered person, the 5-year-old that would love you one moment, discard you the next. And the impact on our health is that there is no place to go. Why I was talking about the drop-in centers for men is we've got one for women where we hand Taranon to the child who has to watch the poop show. And even when the wife or the husband will go back through a trauma bond, at least the kids should be in their own program. So we're working with a teen group called Promly to bring our Taranon groups to kids. But today's impact on men is so huge. And I want you all just to know that you're fighting the amazing fight. When I entered this world, I started with Partners in Men's Health, and John was in PASG, and Milo came to Oslo. And I'm glad I came on early, because I do think we all need to be much more united, much more resource driven, and help each other through the door of health and healing. I saw a great power there, and I would love to continue to do Taranon for men and grow it. The one thing, I'm going to turn it back over to John to talk about this, because I think he's more expert, because he was the guy who brought me up greatly in this. I would love if you all got involved And as we develop Tar-Anon for alienated adult children and for men, if you would just send me issues, we're a fellowship. We're not a clinical program. It's men healing men, and it will be alienated kids healing alienated kids. But send me your suggestion and get involved with our fellowship. We would love to get involved with your group from a mental health standpoint. You guys are better advocates, better legislative sort of marauders. Of course, we believe it should be changed at the governmental level. But we can't, if we're alienating our own child within while our child is being alienated outside, they'll never be attracted back to us.